Of the great physician welcome you to house call. Our host today are Dr. Chiropractic, Mr. Joe Waller, and Dr. Richard Jensen, who is also a board-certified acupuncturist practicing in Northwest Minnesota.
Welcome to House Call. I'm Dr. Gerald Lala.
And I'm Dr. Richard Jensen.
It's great to have you with us in this dimension of House Call. As the screen says, this is Whiplash, Causes and Corrections, Session 2. We have spent a great deal of time in Session 1, but as a tiny bit of a review, we're going to run a video to try and show you what often happens in the dynamics of motor vehicle accidents. Many times people think, well, because it was just a light tap, low impact on the rear end of my car, the side or the front, that a person shouldn't be injured. But the fact of the matter is that often does happen. Often it's neglected, and we don't want you to have any issues like that. So we'll get ready and bring up that video. You're going to see a car struck in the rear here. Here's a head. See, it's going backwards. Actually, the glasses are flying off, and this is only a 4 miles per hour impact, and that's significant. And we'll run that again. There it goes. And actually, you see that that head actually went to the right side when it was turned. So we would call that a cervical hyperextension right lateral flexion injury. Now, here's a close-up at 4 miles per hour again. Impact. Here we go. Here he comes back. Here's the force. See, that's Newton's law of physics, that we always go to the force. And so there can be significant injuries to not only the neck bones, to the brain itself. Sometimes people have brain injuries as well, and other injuries down into the mid, lower back, and pelvis as well. So what are some of the cardinal signs and symptoms of whiplash injuries? Neck and back pain, headaches, muscle spasms, visual problems, dizziness, lightheadedness, depression, and also some of the others are shoulder or chest pains, numbness or tingling in the arms and hands or legs, cognitive dissonance, meaning that something goes wrong, that they can't process their thoughts in correct order, insomnia or sleeplessness, short-term memory loss, fatigue, mood swings, and as we go along now to some long-term results of untreated whiplash injuries, involve chronic back or neck pains, headaches or lightheadedness, loss of spinal ranges of motion. They just can't turn their head and neck like they used to. Spinal scoliosis, which is curvature. Degenerative disc disease, because if a bone and muscle is injured, so will the discs. The discs just aren't separate entities. Spondylosis or spinal arthritis. Loss of height, because in the adult spine we have 24 vertebrae and we have 23 spinal discs. And if those discs are injured, then they're going to get smaller in size. Hyperlordosis, or as I'd say, hypolordosis, meaning the loss of the normal forward sway in the spine. We're going to look at that, some examples of that in a couple minutes. Now, Dr. Jensen is going to talk about Parkinson's disease and its relationship to whiplash-type injuries or neck problems. Dr. Jensen, please.
Thank you, Dr. Lala. Well, if we look at this next slide, there is a research paper that's out. That was Journal of Vertebral Subluxation, and what we're finding here is from 2004 that they found that Parkinson's disease and muscular dystrophy are related to trauma, that 96% of people with these diseases experienced neck trauma prior to onset. That's a great correlation between those two. 48% had been in an automobile accident. 35.8% had a prior sports injury, and 19.8% had fallen on the ice or steps. So it's not just automobile accidents, it's sports injuries and falls that we take just in daily life. All of them had subluxations in the cervical spine, as we went through what subluxations were in session 1, and I'm sure you'll get more of that this time. 91% of all people with muscular dystrophy patients improved with chiropractic care. That's 91% of them. Then also, 92% of those suffering from Parkinson's disease improved with chiropractic care. So you're sitting up in the 90% where people had cervical spinal care that improve their symptoms with these two diseases.
And because Dr. Jensen and I, being wellness practitioners, we see a lot of people with MS, muscular dystrophy, muscular sclerosis, and Parkinson's disease. And the two primary things they're seeking us out for is, from wellness perspective, is they know they've got the disease. They've been through the whole medical armamentarium. Many of them have been to some chiropractors who have done some work on their bones, but that they're looking for a whole person evaluation, particularly from a biochemical perspective. And if you bring up that slide again, it shows you the significance, and people aren't aware of this, that 95% of those people with Parkinson's disease or muscular dystrophy experience neck trauma prior to the onset of Parkinson's or muscular dystrophy. 48% of those have been involved in automobile accidents, 35.8% had prior sports injuries, 19.8% had fallen on the ice or steps, all had subluxations. That means vertebra out of place. That's what the chiropractor who just works on bones is a specialist in. And they had those subluxations in their neck, their cervical spine. And yes, you can determine some of those subluxations through palpation and some other tests, but the most significant way to determine that is through spinal x-rays. Then 91%, these are significant percentages, of the muscular dystrophy patients improved with chiropractic care. Now, that's not us saying that. We weren't involved in that research program, but that's what the research proved, and we've got the papers there from the publication, and 92% of those suffering with Parkinson's disease improved with chiropractic care. So now we're going to look at another slide that Dr. Jensen doesn't talk about and can just show you what can happen to an untreated or not properly treated spine after a whiplash type injury.
Now, if we look at this, there's a spinal scoliosis, and these certainly are, you can see the curves that are going throughout the entire spine. And if you look at it, generally you have a misalignment of the pelvis, and it just works right up where you don't have the correct base, and the spine is going off this way. Well, your body tries to keep the eyes level with the horizon and tries to correct that. Well, it normally overcompensates. And then, because of that, it's got to compensate again. And because of that, it's got to compensate again. And then because of that, it compensates again by twisting the head a little bit, all to keep the eyes level with the horizon. These are compensatory curves that can take place. In this case, it's been out for a long time, and as you can see, some of the ramifications here, if you look at the ribs in this field over here, are much closer together than the ribs on this side of the film. And if you look at this person, you're basically looking at them as though from the back. So this is the left-hand side. This is where the heart is. Guess how much room that heart has to beat? How much room the lungs have to fill? So what we're finding is that this is compromising your cardiovascular system by having such an extreme curve on this side. And that's part of the ramifications, long-term ramifications of having a spinal scoliosis that is not being treated, particularly after an automotive accident. Now, if we look at cervical hypolordosis, that can take place.
This is another common issue from whiplash-type injuries?
Yes,
okay.
Yes. And what you're finding here is, remember we were showing how the head is tilted to the right. Well, when we looked at that video, you saw how the head tends to go to one side or the other, and where you're having a whiplash injury, here their neck is all set off to the side here. Either that's due to contraction on this side or laxity on this side of the muscles, as well as trying to compensate for what's going on underneath here.
And with the curve there, the vertebrae are also out of alignment, so they're subluxated.
Right.
So there's a 91 or a 93% likelihood that eventually that person could come down with Parkinson's or muscular dystrophy.
Correct.
And that would mean true of anyone who has subluxations in their neck. So we're going to, as we look in the future, it is highly likely and highly probable that we're going to see a lot more people with Parkinson's disease and muscular dystrophy.
Right. And when you look up here, you're seeing that there's a lot of that accumulates up in here, and primarily for Parkinson's disease, they have problems up here, the cerebellar problems that are taking place due to an injury to the spine like that. In this one, you're also having that same hypolordosis that we talked about in session 1, where we have actually a reverse curve here, which means a subluxation in the neck. Here you've got one that the subluxation not only is throughout the neck, but you see a flexion subluxation up here in the upper spine where it's so important for that. And remember, all your cranial nerves are situated up in this area too. So you've got a lot of dysfunction that can take place up and down in the organs as well.
And as good as physical therapy and once in a while massage is, that's not going to get those vertebrae back into place.
No, no.
How about cervical hypolordosis? Do you have any other Oh, you do up there, don't you?
Yes, the cervical hypolordosis here. And what we're looking at is hypolordosis. There's supposed to be a curve there, a forward sway curve. And in this case, it's almost a reverse curve here. It's supposed to be curving back this way. This is the back side. And so it's supposed to be curving forward here. And this person has almost a reversal of that curve.
Does that get worse yet?
Oh, yeah.
Oh, yeah. It does, doesn't it? Oh, my.
There we're seeing where the loss of the curves are actually starting to form dysfunction up here. You're seeing excess of calcium being deposited here where there's a lot more dysfunction, and where there's some of the weight is not being distributed correctly through here, and these joints are not moving as well as they could, so they're losing function. They can't move their neck as well as they used to or hope to.
So if it's not treated or not treated correctly, they're heading down the road to some serious problems.
Here it's getting even worse, and you can see where the spaces in between these vertebrae are actually almost non-existent. So the discs, here's where a disc would be, but it's starting to calcify inside there. Here, there's no disc whatsoever here, no disc here, so they're having bone on bone. I'm sure that's a source of great pain in their neck also.
Yeah, a lot of problems.
So then the next slide
and
here.
The next one here is the thoracic spine. We're looking at two side views of the mid-back. The one on your left, the chest is on the front, on the far left. And what we're seeing here on the left is, or on the far right is quite significant, where the person's spine is now going way, way forward. It's coming bent way, way forward. You see a lot of these people out in the community, and actually the vertebrae are starting to collapse. The discs in there, where Dr. Jensen is pointing that out, are almost absent. Great deal of arthritis and disc degeneration. And in that person's case also, we see a significant amount of osteoporosis. Now the one on the far left, the curve isn't as bad, but there's a lot of disc degeneration and arthritis there. Now on the next one, we're going to look at the lumbar spine or lower back. So on your far right, we're looking at the lower back. That's an x-ray of the lumbar spine. And on the far right is part of the abdomen there. And then you see in the center of the film the vertebrae. Those are called the 5 lumbar vertebrae. Dr. Jensen is going to point out there. And see, there's no disc spaces up there anymore. They've all degenerated away. Now, it's taken years for that to happen. And that individual has actually had 3 lumbar disc surgeries before they came to us. And it all goes back to, as far as we can surmise, an automobile accident several years ago. What's also interesting about this, if we look at the front of the lumbar vertebra, this person there, that's their aorta that Dr. Jensen is pointing out to you, and it is calcifying. And so we referred them right away back to their medical doctor in hopes that they would do an ultrasound on that and some other diagnostic tests. Our x-rays showed that it was not an aneurysm yet, but rather just calcification going in there, but still other diagnostic tests needed to be done. If he goes to the back part of the vertebra again, we're going to see what we call the intervertebral foramina. And he's going to bring the arrow down there and show you there. We don't see, there's supposed to be little holes there. Those are pretty good ones, where the nerves, arteries, veins, lymphatics, and acupuncture meridians pass out of the spinal cord. So it shouldn't surprise us that that individual has some significant lower back and leg problems. And then we're going to look at a couple other x-rays of the lower back. The one on the far right here is you're looking at the spine. There you go. That's beautiful. Thank you very much. So
we changed the contrast on that for you.
We'll look at the far left. You can see like little hooks. Dr. Jensen will show you that. He'll point that out. Those are arthritic spurs or spondylosis. That's such a problem there that the body will always do its best for itself, even under abnormal situations. So it's growing extra bone on the outside of the vertebra to try and fuse those together. There's been an injury in there a long time ago. Chiropractic can still help those kind of people. Not as much as we may not have a total effective cure. But again, if you have treatment without x-rays, even massage, I'll tell you, you are putting your life in your hands.
And if you notice on here, this is where the calcium actually grows along the ligament that goes around the disc.
And what that person's body is doing is that it's taking calcium out of bone Instead of the bone being deposited on the inside of the bone where it belongs, it is being deposited on the outside, and that's what predisposes them to osteoporosis, osteopenia, and ultimately fractures, of course. And you do not want anyone massaging, doing physical therapy or chiropractic manipulations on a spine without x-rays. That's our opinion, and Dr. Jensen is pointing that out to you. And look at those big hooks. They look like beaks of a bird. Those calcium spurs or spondylosis growing out there on the spine is just absolutely incredible. Well, let's look at a couple others. Here we see a lumbar spine, a lower back spine. We see the two hips. If we look at the far right, where just below the R, you're going to see that the top of the ilium, the top of the hip bone, is lower on the right than it is left. So that person also has a right leg deficiency, as Dr. Jensen is pointing out there. Now he's going to stop right in the vertebra there, and he's going to point out where those arrows are. They're right there. That's where some spondylosis, or spinal arthritis, and disc degeneration are occurring. Now we're going to look at one more film here, and here we're looking at the lumbar spine from the side. The two blue arrows there, that's that abdominal aorta that is calcifying, and it is very significant, very close to having a major vascular accident with a rupture of the abdominal aorta. And then when we look at the vertebra back there, maybe Dr. Jensen can show you, there we have those spurs and disc degeneration. See, we're supposed to have nice disc spaces in there. We don't have those at all anymore. So now Dr. Jensen is going to bring up a spine that looks a little bit better than this, and this happens to be an MRI of the lumbar spine, and he's going to point out some issues there as well.
Right, so here we're looking at the MRI of the spine, and the arrows here, of course, this is telling us between the first lumbar, L1, and the second lumbar vertebrae, L2, that there's a bulging disc with an annular tear. When they're talking about the annulus is the outside part of the disc, and then there's the nucleus pulposus, which is on the inside, which kind of makes it a hydrostatic kind of a disc to distribute any weight across of it. And what happens is when you have a tearing of that inside liquid type material starts to push out. It's kind of like a jelly donut that pushes out against this posterior longitudinal ligament. If you saw session 1, you saw that in one of the slides. And that then is getting pushed back against the spinal canal, where it can push against the nerves of the spine. And so we have this occurring not in just one level here, but we have it occurring in 5 levels all the way down the spine, where this has some disc bulging that's taking place.
Interestingly, that's fine. Let's leave that up there. Interestingly, many times when these people go for a second opinion to a doctor who does second opinions for third parties, they won't even acknowledge if there are x-rays and they've been sent, or if the radiologist report is there. In their report, they won't even acknowledge that those issues exist. They just say, well, there's nothing wrong with them, they don't need any further care. And of course, that's what some third-party people might want to hear, but where does that leave the patient? They're stuck, right. See, because they've got this doctor who's given this expert opinion, and of course, just like myself, I have a right to give my opinion, there's nothing wrong with that, but very often they don't tell the whole truth. They're just giving the opinion that they know somebody's going to want to hear. Dr. Jensen?
So then as we look along here, this is the same. It's a low back. We've got one vertebrae that's pushed back. And the thing that you see here is when it's pushed back like that, since this vertebrae is attached, the disc is attached to this vertebrae, it's supposed to be attached to this one, but is ripped clear, which gives you a tear in this. You'll have a forward disc degeneration where that nucleus pulposus can be pushed forward, causing pain against the anterior longitudinal ligament. Remember, it's highly innervated for pain along here. And also, you're getting a pinching of the nerves in the back here, which can then go off to the extremities, causing other problems, as well as to some of the internal organs that need its functioning, such as some bowel or bladder problems that can be taking place there. So these are symptoms that we are all trained to look at and see what's going on, and to help resolve those issues. So then let's go on. Here's a near normal low back. You see how the spaces, you've been looking at these x-rays in which they've had these disc degeneration problems. Here you see this is near normal. These spaces are quite large. So when you see when it's gotten way down there, you know there's really a problem. This has a nice curve to the low back. They're all in alignment here. It's just a smooth curve, and when we see a break in that, we also know that there's a problem. So then we come to this next one. There's actually a little bit of a break in this area, and you can see where it's pushing back into this vertebral foramina where the arteries, nerves, veins, lymphatics, all that come out from the spine. It's getting a little bit smaller here. So you're looking at some pressure that could be occurring there. The disc space is starting to get smaller.
So it'd be like phase 1 then.
This is phase 1. Then we can go into phase 2, and you can start to see this progression as the disc space gets smaller, and you start to see more calcification coming off the front of these vertebrae.
That's not going to happen in the first month or two, is it?
No, you can see
That's
a long-standing.
Significant not to settle cases too prematurely.
Right. Here's number 3. This phase is going on. You see there's even more calcification, more loss of disc space, particularly down in the low back. Okay? Then we go on to the next one. Wow. Do you remember that big hook we showed you before in that last one? Here's a big hook, and remember this actually goes along the ligament that's across the front of the spine that covers over the disc material. It's coming out there. It's trying to shore it up. Your body's trying to do what's right for you, but this is making it more of a permanent deal because there hasn't been care there. When the joint is dysfunctioned, the body tries to seal up that joint so it's not going to cause you more pain. Okay, so that's phase 4. We can even get worse than that. With phase 5, you can see where it's even worse. The disc spaces are almost all gone all the way through. And this is almost like that one MRI that we were showing before, where you've got to have this stuff poking out into where the spinal column is. Not the spinal column, but the neural canal where the spinal cord is, causing some problem back there. So these problems just continue to propagate and get worse and worse unless taken care of. So then there's diagnostic evaluations, Dr. Lala.
We've been really talking about this, but just as a nice list for you, certainly there should be full spine x-rays, detailed spinal examination, MRIs or CT scans, EMGs, and nutritional evaluation. And then we have a cute little slide here for you that hopefully if you're going to a chiropractor that they've really done a comprehensive entrance case history, past medical history, and that they have done good examinations, not just some superficial thing to sell you to get on the table, but to have good chiropractic care. And then Dr. Jensen is going to look at some nutritional protocols. And as he does that, we're not saying that this is what you should do. We're not making a suggestion. We're bringing it out there so that you could look at it and then consider that and ask your doctor about that. Certainly, if we were to ever see you, this certainly would be in our mind. Dr. Jensen, please.
Thank you, Dr. Lala. Well, we have areas that we want healing to take place now within, well, we have different areas of things that need to be taken care of with an injury. And one of the first and foremost things is the healing part of this. So what we do is with nutrition, we want to replace those amino acids that for healing. These amino acids are basically the building blocks of protein, and you are made primarily out of protein. And so the amino acids adds to the pool of these protein building blocks necessary for structural production of that connective tissue or of collagen. Vitamin C. Vitamin C is very important. Well, actually, vitamin C, iron, and alpha-ketoglutarate are very important for the formation. They're required for the hydroxylation of proline and hydroxyproline needed for the production of quality collagen. So it's not just the function, it's not just the creation of the connective tissue. We want quality tissue in there. Now, if it's been a trauma, then we want to look over here at some of the homeopathics. And the homeopathics, what you want is something to help take care of blood clots that may take place in there. If we were looking at from an acupuncture point of view, we might have something to help the spleen in that case, because the spleen gets rid of old blood and helps recycle those things. Congestion of the blood, we want to help clear any bruising that can take place. If that bruising isn't cleared, we can actually end up with a calcification in that area, and you don't want calcium forming inside of your muscles. That causes a mechanical problem in there and quite a big cause for pain there. Traumatic injuries. There's things for traumatic injury, as well as what you want to do with homeopathics is avoid caffeine, menthols, which interfere with the function of homeopathics. It kind of resets the body in that regard. For inflammation, Proteolytic enzymes, these are things like trypsin, chymotrypsin, bromelain, papain. These are things that can be found in some foods that we eat. However, what they are is they're enzymes that help take care of proteins which would help, form outside the blood vessels or are found outside the blood vessels because of the trauma and hold water there. So to take care of those helps inflammation go down. Bioflavonoids also helps in this aspect. There's some herbs that will help bring down the signals of this, as well as, like herbals such as boswellia, ginger, turmeric, and cayenne, which will bring down some inflammation. Essential fatty acids will also help with inflammation. And the inflammation signal inhibitors, one interesting inflammation signal inhibitor is hops extract, which has been shown effective in reducing pain. They almost liken it to some of the over-the-counter drugs because of its effectiveness. Then debris clearing. Debris clearing, they want to use things like antioxidants such as vitamin C and E. Zinc and copper and manganese act as cofactors and catalysts for a potent antioxidant enzyme called SOD and are therefore referred to as the SOD induction complex. Oral supplementation of SOD can be attempted, however, the digestive process tends to pull it apart. And calcium also helps with the relaxation, and once you relax the muscles, it can help reduce the help clear some of the debris because of the muscles actually holding some of it back. So then, true health, Dr. Lala.
True health. We are a spirit living in a body with a soul, memory, and emotions. And we see so many people who have legitimate organic health problems. We praise the Lord that He has attracted those people to us. Also, a lot of people have some serious health issues, and they really need to have a supernatural dimension in their life. And of course, we believe that is the great physician, Jesus Christ, that we need to become born again spiritually, and that we would come and walk in the life with Christ by faith through grace, because Jesus came in grace and truth. And a lot of religion is very law-based, but Christ came to satisfy all of the law. And if you've got some health issues that are not being resolved, maybe you need to talk to somebody else who has more scientific ability, and maybe you need to, in your own way, talk to Jesus and have a little faith and say to Him, Jesus, can you help me out with these issues? And He will. He will, regardless if you're going to church or temple or whatever it might be. He will come to you because He is a God of grace and truth. He loves you unconditionally. He'll help you. He'll heal you. He is honor-bound to do it. As a matter of fact, if you've had some sins in your life, and I want to tell you everybody has, His blood has already washed away all of those sins. They really have. It doesn't matter if you're involved in the whiplash or you have Parkinson's or muscular dystrophy, or maybe you're doing good. A lot of people don't reach out to the Lord when they're a little younger in life, and some people just trying to do everything themselves, get well themselves. And I thank the Lord that I've learned that I'm going to see patients to try and be an instrument of God, not to preach religion to them or anything like that, but to say, hey, there is a supernatural dimension, that God does love you. Regardless of what's going on in your life, He can help you. He really will. If you just reach out and ask Him, He will do it. He really do. That's one thing I can guarantee to you, that Jesus will reach out and He'll help you, particularly if you see Him as a God of grace and truth.
House Call TV has been brought to you by the Fellowship of the Great Physician. For further information, please call at 651-484-8521 or visit our website at www.housecalltv.org. Until next time, thank you for listening to House Call.